Hi guys, let's speak tonight about COVID-19 runner knee pain. Just like everybody in the UK right now, you've most probably started running or increased quite a lot your amount of mileage you've been doing. We've been stuck at home, we've got 1 hour a day, let's make the most of it. So what do? We just pound on the pavement, bam, 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 bam. Within 3-4 weeks, if you've not developed an Achilles tendon problem, your knee is going to be the one that is going to bother you. The first problem we are going to look at is what we call anterior knee pain or patellofemoral syndrome, which is an issue between the kneecap, which is called the patella, and the femur, which is the thigh bone. And as you know, the kneecap should be running in the what we call the femoral groove during the movement of flexion and extension. You are going to start getting inflammation in that area, in that joint, due to generally an increase of loading. It's always the same story in physiotherapy. It's all about the loading, and here it's going to be the repetition of that movement when the biomechanics of the knee is wrong. So what do I mean by that? Well, if you are quite new to running, or you've just increased your mileage, your speed, your cadence recently, suddenly asking your body to do a task it's not been used to, and you're going to repeat the amount and flexion by quite a bit. And if your muscles, the thigh muscle, which is the quads, the hamstrings, the calf muscle, have not been used to that amount of loading, that should have been done progressively, and 3 and 4 weeks is not progressive enough, you are going to increase the amount of stress onto the kneecap as it rubs onto the femur. And this is an increase of stress, of tension onto that joint that is going to give you that pain. So what can you do to try to make it better? Well, unfortunately, on that occasion, there's no secret. You need a bit of rest. You need to just let that joint breathe a little bit. You need to let it rest. So you can do whatever you want that doesn't give you any pain. One of the very good things is cycling. It's not exactly the same movement. It's still knee flexion, obviously, but it's not working exactly the same way as the joint. And very often the knee joint is going to respond very well to that. And as soon as you start to feel that the knee is feeling better, you feel less in pain in the morning, getting up after sitting is not an issue anymore, this is when you want to start running again. But you don't go for a 5 mile, you don't go for a 3 mile. You start with 1 mile and see what it goes. Once you're able to do your first mile without pain, this is when you can start building up again. You just going to just increase by half a mile every time you go running. And maybe you don't want to go running every day. Every second day is maybe what you need just now. And this is during this period of what I call active rest that you should maybe try to work on your hamstrings lengthening by doing a lot of hamstring stretching, trying to work on your quad strength by doing some quad strengthening. You might also want to work on your glute strength, your bum muscle strength, because they are very closely related to anterior knee pain. Running normally again with less pain, which can sometimes take 6 to 12 weeks. It's that long we're speaking about. This is when then you start doing variation in your training. Don't always do the same loop, don't always the same distance, don't always the same pace. Try to give you a lot more variation, try to go off-road, and continue with your strengthening exercise, continue with your stretching, because at the end of the day, they are going to help you to just avoid being injured. And the last thing you want to do once you've become now a runner, because when you've been running for 3-4 months, you are never going to stop, is to be injured.